Hello everyone, welcome back to Dr.shil's Physio Victory, your one-stop channel for government job and master's physiotherapy entrance exam preparation. In today's video, we are going to discuss GSSSB Physiotherapy 2020 previous year questions part 4. Let's start. Today's first question is, energy required to change the state of a substance is called as option A, kinetic energy, option B, potential energy, option C, latent heat, option D, chemical energy. Here, the correct answer is very easy. That is option C, latent heat. Latent heat refers to the amount of energy that must be absorbed or released by a substance to change its physical state without altering its temperature. Okay. Next, come to question number 76. Among the four rotator cuff muscles, the only medial rotator is option A, subscapularis, option B, supraspinatus, option C, infraspinatus, option D, teres minor. Here, the correct answer is option A, subscapularis. Subscapularis is the only muscles for medial rotation. Femoris and the other muscles, actually supraspinatus, basically initiates abduction and stabilizes the femoral head. Infraspinatus perform external rotation and it also stabilizes the femoral head, and teres minor is also external rotator and adductor. Next, come to question number 78. The purpose of an inspiratory hold with an incentive spirometry is to option A, prevent curly closure of the alveoli, option B, increases the intrapleural pressure, option C, increases the functional residual capacity, option D, facilitate collateral, this is ventilation to occur in the alveoli. Here, the correct answer is option D, facilitate collateral ventilation to occur in the alveoli. An incentive spirometry is a device used after surgery basically the inspiratory hold pushing the peak of inhalation for a few seconds allows time for air to distribute evenly through the lungs via collateral ventilation pathways such as the pores of cone and canals of Lambert. Next come to question number 79. When ice is applied to a body part, the initial reaction is option A, increase in blood pressure, option B, decrease in blood pressure, option C, vasoconstriction, option D, vasodilatation. Here, the clear answer is vasoconstriction. Cryotherapy triggers an immediate physiological response in the body to conserve heat. Next, come to question number 80. Out of the following heart defects, which one is cyanotic? Option A, PDA, option B, VSD, option C, ASD, option D, TOF. Here, the correct answer is option D, TOF, or the tetralogy of Fallot congenital heart defects. It is patent ductus arteriosus, VDS is ventricular septal defect, is uh, atrial septal defect. An atrial septal defect, hole between hole between sorry atria. Next, come to question number 81. Percussion should not be used in an untreated case of option A, bronchitis, option B, bronchiectasis, option C, pneumothorax, option D, aspiration pneumonia. Here, the correct answer is option C, pneumothorax. Chest percussion is a manual technique in chest physiotherapy to loosen and mobilize secretion in the airways, aiding clearance in conditions like cystic fibrosis or pneumonia. However, in an untreated pneumothorax, percussion can increase intrapleural pressure or dislodge air, potentially worsening the collapse or leading to tension pneumothorax, which is a life-threatening emergency. Next, come to question number 82. Limb length measured from the anterior superior iliac spine to the inferior border of medial malleolus with patient lying supine in the anatomical position is termed as option A, true limb length, option B, uh, this is option B, apparent limb length, this is option C, false limb length, option D, uh, pseudo limb length. Here, the correct answer is very easy. Option A is the correct answer. True limb length. Next, come to question number 83. The movement of joint surface, it will be surfaces is referred to as option A osteokinematics, option B arthrokinematics, option C kinetics, option D pathomechanics. So joint surface movement is called arthrokinematics. Osteokinematics is basically gross bone movement. Kinetics is study of force causing motion, and pathomechanics is abnormal mechanics leading to dysfunction. Next, come to question number 84. Which of the ions delivered through iontophoresis can be used in the treatment of calcific deposition? Here, option A is zinc, option B acetate, option C hyaluronidase, option D chloride. Here the correct answer is option B acetate. Zinc is used for wound healing, hyaluronidase for edema, next come to question number 85. In a Monteggia fracture, the nerve that can be involved is option A radial nerve, option B median nerve, option C ulnar nerve, and option D posterior interosseous nerve. Here the correct answer is option D posterior interosseous nerve. Monteggia fracture basically involves a proximal ulnar fracture with radial head dislocation. The posterior interosseous nerve, which is a deep branch of the radial nerve, can be compressed or stretched by the dislocated radial head, leading to wrist extensor weakness or paralysis without sensory loss. Thank you everyone for watching this video. Please do like, subscribe and share this video. I am Dr.shil and this is Physio Victory, where success begins. See you in the next class. Bye.